This is our April 10th, 2024 TRA coffee chat. And today we're going to chat a bit about neuropathy, hands and feet, right? But we can also chit chat about anything else. It's fair.
Okay.
So I'm assuming everybody here has seen clients with neuropathy, right?
Mm-hmm.
Cool. Which do you find more common, foot neuropathy or hand neuropathy in your practice?
Foot.
Definitely. Way more foot foot neuropathy than hands. Mm-hmm. And what's the more common culprit of neuropathy that you've seen?
Probably diabetes, but other too. There's other things too. I have a couple people that it's not diagnosed. They think it might be just from their working. I have a dental assistant, and the way she was twisted for all those years, it I think worked on her lower back.
Yeah.
And now that she's retired, she has a problem with that.
Wow. Oh, bless.
I have one from a drug, Levaquin caused it, and then another
Which
one, I
one?
think Levaquin.
Mm-hmm.
And then the other one, the main one is, I think it's just age, maybe.
Yeah. Yeah.
I have a couple of chemo patients that are now experiencing, as they're going through the process, experiencing the neuropathy in their toes, and then I have another client who had a really severe fall and injury, and caused for many years paralysis, and eventually was able to walk again, but she's basically from the knees down, complete neuropathy.
Yeah. Ugh. It's rough. I have clients that have neuropathy from multiple sclerosis and spinal stenosis, the narrowing of where the spinal cord runs through the vertebra, right? As that gets narrow as we age, causing some funky feelings in the toes. Definitely lots of chemo-induced neuropathy, diabetic neuropathy. Occasionally I'll get, like Brenda was saying, like medication side effect, like Levaquin, some other heavy duty, sucks.
I think the cool thing about reflexology, because I'm a massage therapist as well, they get kind of a 2-for-1 treatment when you're working on the bottom of their feet or all over the foot, because we're working the soft tissue, and that helps them. And then as far as the nerve work or the reflexive work that we're doing too, that is affecting the whole body. So I tell people you're getting a 2-for-1 special if you're having a reflexology session versus just massage, because of the time we spend on the feet. And a lot of the people that I work on, even people with lymphedema too, or some type of swelling in the feet, they feel like their feet are so much lighter when I'm done, and they feel so good that they want to go home and take a walk, whereas before the swelling was making their feet heavier. So we're moving everything for them, which is good.
Bravo. Yep. I like the 2-for-1 idea. It's good marketing. What kind of progress have y'all seen using reflexology for some of your neuropathy people?
The effects last for several days for
Okay.
one of my clients. She's just thrilled when she comes in, and she was only a massage
Okay.
client
Oh,
until
you
I
converted her
started
to
doing,
reflexology?
yeah. So,
Woo!
yeah, so she's thrilled with it. Absolutely thrilled.
Awesome.
Yeah, that's been my experience too, is it just, you know, the more frequently at the beginning that they're coming, the longer it lasts.
Yep.
Even I see sometimes when once we do sort of step down to you know, less frequent, they still are, you know, get that couple of days, you know, where they have more feeling. My favorite though is when you're working on them and it's like, oh, I felt that, you know, it's like I don't know. And it's like all of a sudden something breaks through, and that's always exciting.
Agreed. Yes. I love that too. Or when they're like, I know you're on my toes. Which toe is that? And I'm like, oh, you can feel the toe. Oh, okay. All right. We're making progress. And then maybe several sessions later, they're like, is that the third toe? I'm like, it is the third toe. Yes. Yes. We're making headway. Slowly but surely, right? Have y'all encountered any really stubborn ones? I've had a few sticklers over the years where we worked for session after session after session. We didn't make any headway. Ugh.
I think sometimes it's a mental thing, right? I mean, if you come in and you're skeptical and you're like, I'm trying this, but I don't know if it's really going to help me, or, you know, whatever. I I think that we get, you know, what we want, what, you know, and so I think sometimes the biggest hurdle for people who have had neuropathy is just trusting and accepting of what is, and allowing that you know, work to do what it can do. And so, you know, I think we're all here and we know that we don't overpromise anything. We have a conversation with them about what reflexology could do, but not promise that it will.
Yeah.
So hopefully that's enough for them to believe and allow. And so then they can have some positive outcomes. But I think for most people, it's just getting out of their head and believing. So
Yeah.
Yeah, I had one MS client. We worked together about 6, 8 months. And I was like, dang, we're not getting anywhere. We're not getting anywhere. We're not getting anywhere. And I was starting to feel really kind of defeated because that's a long time to be working with somebody and not, we were making headway in other areas with the MS, the muscle spasticity, the urinary incontinence. We were doing some other stuff, but the feet were just, from the knees down. She described them as like tree stumps. Like she didn't know where they ended. And she got to a point where the state was going to revoke her driver's license because she had been in too many car accidents because she couldn't tell which pedal was the gas or the brake.
Ooh.
And I was like, oh, this is so hard. And I knew that if she lost that independence to be able to drive herself, that was going to be really difficult. So of course she loses the driver's license and she's got a chauffeur. She had a family member bringing her to her appointments. And she calls me one night at like 8 o'clock, 8:30 or something. And that's my wind down hour. Like I'm starting to sort of turn the brain off. So I'm thinking, is she calling me because I'm the only contact? She slipped and falls. So I was the first person that came up on her contact list. It's A. And so I answered it just thinking, maybe this is a medical emergency, right?
Mhm.
And I'm one of a handful of her wellness providers. So, and she's Amy, something changed. Okay, something changed. I'm sitting here like, I'm worried. I didn't realize she was excited. I thought she was, kind of frantic. And she's like, the water is wet. Yes, water is wet. Why are we talking about what is happening here? I'm so confused. She slows down and, I'm like, okay, start from the beginning. She went into the kitchen. She tripped over the cat's bowl, stepped in the water, and felt wet water for the first time in 12 years.
Wow.
And I was like, whoa,
Oh.
okay, we're on to something. Her follow-up MRI, the doctor was like, the machine doesn't work. We have to send you for a second one. I sent her for a second, right? Because she would get them every 6 months. And so then the doctor's like, well, who else are you seeing? Did you try a new experimental drug? Are you doing this? Are you doing that? And she's like, nope, I'm still doing all these things. I just added reflexology this year. And he's like, what is that? So then I get this letter in the mail from the doctor with a signed release from her letting him contact me. He wants to talk. And I'm like,
Whoa.
okay, this seems intimidating, but sure, yeah, I'll talk to your neurologist. No problem. And I call his office, they get him on the line, and we're talking, and he's like, so what exactly are you doing? And I'm like, with this client? He's like, yeah, what are you doing to my patients? I'm like, oh, okay. Okay.
A little territorial.
She's her own person, thank you. But yeah. So I'm explaining what I'm doing with the reflexology work, and he's like, okay, I'm gonna need to understand this a little bit better. Can we meet? Because I have these papers and I need to understand what's happening. Sure. Why not? I'll meet with a top neurologist. No problem. We met and he's looking at the research papers. He's like, this study out of Israel, this study out of Denmark, this study out of, he's got all of them laid out all over the desk. And he's like, make it make sense that when you press things on the foot, the brain, and he's like, and this is the MRI. So he's showing me the MRI from before reflexology and after reflexology. And the dark gray spots on the brain disappeared. And he's like, we did it twice because this shouldn't happen with multiple sclerosis. And I'm like, I don't know what to tell you, dude, but I just did reflexology. I did my job.
Yeah.
Yeah.
Wow.
Nicely done. Nicely done.
Amazing.
He was really all fired up about it. Like, it doesn't make sense. It doesn't make sense. And I'm like, do you want her to discontinue the sessions? No, not at all. She needs to continue. I was like, oh, okay.
You'll be getting
Wow.
more.
Yeah, I was gonna say, tell him to send me all your patients.
Right. Oh, I got all his. Yeah, he sent me a lot of MS people. I was like, okay.
Wow.
It was wild. She got her driver's license back, and then
Wow.
reflexology was included on her disability plan, so she paid less rent, because she was in state housing. She ended up paying less rent to receive reflexology based on the doctor's orders for reflexology. And that was the first time that had ever happened. I was like, well, oh, okay. Yeah. She
I
got,
just had a,
probably
I
like
just had a, oh,
I
I'm
was
sorry,
gonna
go
say
ahead.
she got probably 80% of feeling back in her feet and legs. It was still like that kind of pins and needle stuff, but she could tell when a shoe was too tight. She could feel both pedals in the car. Really, really wild. Fun story. I always love telling that story. It's super fun.
Oh,
That's
wow.
really cool.
Tell my
I just had a client come in last night, and she's a regular massage client, and she has stuff, digestive stuff going on, and she ended up with a severe cramping over the weekend. And she was supposed to get her MRI on last Friday, and she ended up going into the hospital Friday morning with severe cramping and sharp pain by her ileocecal valve and her appendix. And so, and nowadays when you have pain, they think you're drug seeking. And she's a retired uh, DCF worker. So it's not like, she's dealt with lots of stuff, but so anyways, she goes into the hospital. They won't give her MRI now that's scheduled for that day for later in the day, because as soon as you're admitted to the hospital, apparently they don't let you keep those kinds of appointments, even though she needs the MRI. So anyways, she ends up in the hospital for the weekend, and they have no idea what is going on in that area. And it's been going on for years. And she came in yesterday, and I told her we should do reflexology to see what if that would help. So I'm very excited, because she said she felt a tingly sensation going all up her body, and she's so happy to try something new, because the doctors don't have an answer for her. And so I'm very excited for her to hopefully she'll start to see results soon. But I worked on the whole digestive system, the spine, the hip, and the lower back, and I just was concentrating on the areas that kind of that could help that particular situation. So I'm so excited to follow her and see where it goes. I hope I can help balance her. And she was very disillusioned with the medical profession, because they have everything at their fingertips, but everything's controlled by insurance, or it's controlled by policies. And she's like, why couldn't I get my MRI that day to see what was inflamed when it was happening? So now they've got her booked out the end of the month to get this MRI, because the appointments are so booked. It's just crazy. But no, it's stories like that, like you said, and like with this client of mine, I that makes such a difference in a person's life, when we can do something holistic for them.
No, and the fact that getting in the case I was talking about, getting her MS team on board, it was a game changer for her.
Yeah.
It made a huge difference in her overall health. Her quality of life scores ticked up. I don't know. I love doing a quality of life score with clients that are in that kind of position where it's like, okay, this is interfering with so many aspects of your daily activities, or the activities of daily living, the ADLs. And just having them do a basic, quality of life score, run through it, before reflexology, and then work together after, do a check-in.
But at least she hung in there and didn't give up for, she could easily, a couple of months, that's not doing any good. And then, so.
And you hung in there too.
No, I was feeling really defeated. I was like, why can't we just this one, it's such a big, but the MS didn't get there overnight, and reflexology can't help assist the body overnight. It takes time. And I think that can be defeating for some people when they're, so I think that's one of the first conversations that I like to have with folks, that we may not notice any changes. It may take a while.
I've had a client that her feet are pretty much numb. I mean, not totally numb, but numb.
Yeah.
Then when I work on it and then something hurts, well, she doesn't like that. And I'm thinking, if you're getting feeling, it's not a pleasant feeling, but, and I'm not pressing hard. It's just, you know, it's like, but
Well, that can sometimes be where, a client wants to be heard when they're like, "Ooh, that's really sensitive." So I might be like, "Oh no, these poor," if I'm going to use my foot model here, right? If I'm working over here and it's sore, I might just make my foot sandwich, my little foot hug, and be like, "Oh, that poor part, yeah, just was feeling a little extra spicy," or whatever your personality is, whatever your client, however they need to be seen and heard, pausing with that, and then go, okay, well, tell you what, let's come back to this area in a little while, see if it, chills out a little bit, and move on to another part, come back to it and see, but I'll even say, like, okay, I'm going to come back to that area. I'm going to be real gentle, but you give me a heads up if it's still feeling pretty cranky, you know, especially where they're like, I don't like how that feels. That's, some people are like, "Ooh, that was a zinger. That's cool." And other people are like, "Ouch, I hate it. It's terrible. All pain is awful." I'm like, "Oh, okay. We're just the sensitivity tuner the knob has been turned up and maybe broken off."
yeah.
and left on high. Oops.
Yeah.
Right?
Right.
Not everybody has the same kind of pain threshold,
Mhm.
you know?
So when you were seeing her, how many times, was it once a month or every couple
We
weeks?
started working weekly and then went out to every other week
Okay.
for months. Yep. I worked with another MS client that had a more remarkable response to the reflexology, but also in the same vein, like she was one of my case studies when I was writing when I was doing my research project and writing my research paper for reflexology school. I was working on MS, and I would go to her home. She had been bedbound for 7 years in a hospital bed. She had been a very active 20 something, and then MS hit, and she had a very aggressive advanced form of MS. And so she couldn't hold a comb to brush her hair, right? Um, and we worked together. I saw her weekly. I think we did maybe 5 or 6 sessions together and then took a break. She had stuff going on with her household, her family, and relatives were coming. It was going to be a chaotic time, and I was going to be out of town. So we took a little break, and I came back and she answered the door.
Wow.
And I was like, "You got on the new trial. They let you in. This is so amazing." She's like, "Amy, I didn't get into the trial. I didn't get into that drug trial." And I'm like, "Okay, what happened?" She's like, "You happened." I was like, "What do you mean I have? What are you talking about?" I did not for a second think it had been reflexology.
Isn't it funny how we all know, but even though we know, we still forget, right? We forget how amazing this is.
I mean, I had never heard of any case study where someone had 6 or 7 reflexology treatments and went from total bedbound, not, needing a caretaker to wash their hair, help them eat, couldn't lift a spoon to their mouth. And she answered the door, dragging a folding chair behind her in case she got tired. I was like,
Wow.
wait, what? I was like, I think we're gonna have to maybe leave this one out of the research study paper because that's like it's gonna really skew the data. I was like, what is happening here?
Um,
Yeah.
I want to share a story. I have an elderly client. She's in her 70s. 13 years ago, she had a titanium plate inserted in the neck, right? And after the surgery, she became partly paralyzed.
Okay.
And she couldn't move the hand much and couldn't do anything with it. And she's been walking with the cane for all this time. And she's been coming for reflexology for almost half a year now. And we got to that point that she can use her left hand now, and she's doing stuff with it. And she's walking without the cane. And she's walking slowly, but I always tell her, don't worry, the point is you're walking and you're using your hand. And because I do hand reflexology and foot reflexology together, and she sees a tremendous improvement, especially in the hand. And whenever I work on her hands, like, oh, I feel it in my foot. I feel it there. I feel it here. Like, it's so amazing to hear that feedback. It's like, okay, I love that feedback. Please always tell me. And she knows, like, Lord, this is what I feel. This is how I feel. It's like, great. Like the body's talking to me. And she's like, I'm so happy. And she was coming weekly for like 3 months. And now she's been coming twice a month. So I'm just very thrilled every time she's coming, to hear some improvement and how she's functioning better. She's able to do stuff, drive, because even driving, she was, like driving with one hand and stuff like that. So it's like, now she's able to do more stuff with the left hand. So it's like, I'm very thrilled. So it's always good to hear these kind of stories.
I think it's important to share these kinds of stories and the frustrating ones too, right? Hear both of big success, and then ones where you're like, we didn't make the headway we thought we were gonna make.
Yeah, it's really great. Yeah, I have to step away for a second because of the storm. We end up having issues with, now we cannot open the garage, so I have to go.
Oh no! Dang storms, got really spicy. This weather.
I think people are taking their healthcare in their own hands nowadays, in a good way, where they, they're thinking outside the box and they want to try holistic ways of doing things rather than taking a pill. And I think that that's what's going to grow our profession, because the thing that people have to learn, though, a pill is immediate in a lot of cases, but reflexology can take a little longer because it has to build on itself. But we just have to work as professionals to let them know that the benefits are there, but they're not maybe going to be always immediate. And that, I think, is part of our job too, as reflexologists. But the long-term benefits are big, and they have to just be open to it in their minds too, not just physically.
Yeah. And also being very clear that reflexology is never going to take the place of, Western medicine.
Right.
Ever. That's not our job. I'm not in competition with anybody's primary care physician. I'm not in competition with the medication they're on, ever. Right? I don't want to ever be in that position where it's like, should you do reflexology or take this prescription? Hell no. Nope.
No.
That's never going to be. We're a complement, not with the I, with the E, right? We work together.
Yes. Yeah.
But yes, having autonomy over one's body, being able to make your own medical decisions, asking questions, and especially, in the examples we've heard already, where your client didn't get seen, she wasn't heard, and that's really common, especially for women, right? You know, we're so far behind on any research data for bodies with a uterus. It's unreal. It's absolutely unreal. The majority of all medication trials and research is done on men because they're worried that the uterine and ovarian cycles will impact the medication. And I'm like, well, yeah, duh.
Yeah.
But that's
Yeah.
why you
Or
keep
if
studying
people are
them.
pregnant. Yeah. Or if people are pregnant too, you can't test medication on a pregnant mom. You know, you can't. They don't do that.
It would be
So
unethical. Mhm.
so that's another part of it too.
Yeah, but how much research is done on, appendix inflammation and the uterine and ovarian cycle?
Yeah. Yeah.
So they don't know what to do with your car. We'll hold you for the weekend, but we don't know what's going on in your body.
Yeah.
Like, well, oh, I'd start with the migrating motor complex and maybe go from there, but that's just
I think that was great though, that the doctor wanted to sit down with you. It
Oh,
just
I
shows.
love that was a huge game changer for me because as a reflexologist previously, I'd been kind of terrified of having a conversation with a doctor, face to face or over the phone. I was like, this is scary. We have light years of differences in our education, our understanding of anatomy and physiology. I've been to one cadaver lab. Hello, I do not know what this doctor knows. And I'm like, I felt like imposter syndrome. Like I can't even be at the table with this. This is no. And that doctor asking me the heavy questions of like, why does this work? And I'm like, oh, okay. So you can be the expert in your field and I can be the expert in my field and we can both be at the same table and have a conversation. And that was what changed the narrative for me to be like, okay, cool. I can be at this table. I can have this conversation. And now
Yeah.
I hang out with doctors all the time now, which is great. And I love it. And I'm like, oh, tell me more about this. This is really cool. What you're doing. I love this, right? And they can say the same of me. Okay, so hold on. How does reflexology work? But I didn't think it would help with digestion if we'd just been talking about, joint pain. And I'm like, well, the thing with reflexology is that if you own a body part, there's a reflex for it. Right? Yeah. So theoretically, it could help with any body part. I think one of the bigger challenges in working with neuropathy is navigating pressure, especially for our neuropathy clients that are on a lot of pain management tools, right? I've had clients that come in and they are on, they're on gabapentin and a lot of other really strong medications that make it really hard for them to perceive information, to receive sensory input anyway, plus the neuropathy. And that's where, we have to get into real light touch, like I have to work at not using a lot of pressure because that's not my I don't work from a lighter pressure technique. So I have to work harder to, pull back, not use as much because they don't have the capacity to be like, oh, that's too sensitive because they can't pick up on that data. Anybody else have a hard time with that? Am I the only one that's like,
I work really light, so that is right up my alley.
perfect?
Probably work a little on the heavier side because I was trained by somebody that works on the heavier side.
Little more in the nurturing pressure technique, a la Bill Floco.
Yeah.
Yes, yes.
I had an interesting experience working on my deep tissue massage therapist friend. So his work is very like therapeutic, deep pressure. So he's accustomed to making people feel uncomfortable, and he prefers to have that kind of work too. But he's also been in like multiple car accidents and has plantar fasciitis, so he's willing to be a case study. But in the first one, he was in so much pain when I worked on him that like he was grimacing his face, but he insisted, no, I want more pressure. And I'm like, I'm not applying more pressure. Like this is past your pain threshold. And then
Right?
I worked on him again 2 weeks later, and I could apply firm pressure and it didn't hurt him. There was no like cringe in his face, but that was incredible to see that progression.
That's huge. Nice work. Yeah.
And he's also a massage therapist who he's researched reflexology, but he's in the camp that like he doesn't believe it. And so it's really cool to kind of see his like shift and like openness to it.
But reflexology believes in you. I love it. Yeah, I've encountered different folks that are like, I love reflexology. It feels really good, but I don't believe it's doing what you say it's doing. I'm like, that's fine. You don't have to. Right? You can come just to enjoy. If that's what you want to get out of reflexology, that's what you get out of reflexology. You're not going to hurt my feelings if you're like, I don't believe that there's a liver reflex on my foot. I'm like, that's fine. I'm not worried about that. You're not hurting my feelings.
I think that has been the way of a lot of things, though. There was a point in time when, doctors wouldn't prescribe massage for people because there wasn't enough research to back it up that this worked, but they would come get a massage because they knew it felt good. And I think the chiropractors went through that too, where that was thought as being very foo-foo and not effective. And then as more research is brought into the profession, that's when it gets a little more concrete, because a lot of doctors need that black and white in order to prescribe something for their clients. And I think in this profession we're getting more and more of that, and we're going to see better and better results. And that's why, with like my clients that want to take things in, to their own hand and make medical decisions. And I'm not saying it they're making it without their doctor's help. I mean that they're thinking of other ways of doing what they're trying to achieve. And the more research we get in this profession, I think the better off we're going to be as a whole. And so I'm grateful that you've done research and you've had papers and things. I think that's wonderful. That's really, really good.
Well, and I think as we see more reflexologists in our communities having candid conversations, sharing about the work that they're doing, right? This is having a ripple effect, just like acupuncture. I mean, acupuncture in the 1980s was like, what the hell are y'all doing? Needles? You're going to voluntarily lay on a table and you're going to have needles? No, 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 no. And here in Austin, we're losing one of our acupuncture institutions, but when I first moved here, we had 3 acupuncture schools running, and dang, if there wasn't an acupuncturist on every corner, and I'm like, that's It's like when you look at Denmark. There's more reflexologists per capita than there are physicians in Denmark. And over 80% of the population has received at least one reflexology treatment. You know, and they, of course, they have great research studies coming out of Denmark because they have the numbers they have, you know. So I'm like, yeah, okay, we'll get there. Maybe even within my career's lifetime, we might be like, hey, there's a reflexologist in your neighborhood. You know?
Well, I think part of the problem, at least here in Texas, is that because there are no laws, you know, anybody can call themselves a reflexologist, but they're not necessarily doing reflexology. I have such a mixed bag about when people tell me, oh yeah, I've had reflexology before, because I'm always like, have you? Let's talk about that, you know? And so a lot of times it is letting them know that the reflexology that they got before is, and of course I don't want to bash anybody or, you know, whatever, but you know, letting them know that what I'm doing is a little different than what their reflexologist slash foot massage was giving them, you know. And so it's difficult when we're not all on the same page. We don't have the same education and backgrounds and all of that. And so, you know, it does sometimes put out a false sense of what the profession is.
Yeah. I mean, I definitely hear you. I frequently talk about Father Joseph's history, his timeline, and why the 7 techniques that he taught people, his parishioners, to use is what's used in every foot massage parlor on the planet. And I'm like, that's great. It's really great. But it's not all that reflexology offers. I'm like, that's like being like, you know, you went to Pizza Hut or you went to Domino's and you tried a 1 topping cheese pizza and you're like, wow, this is really cool. And I'm like, yeah, but have you added more toppings to it? Have you ever had pizza that has like, we made the dough fresh today. It didn't sit in a vat in a freezer or something. We use fresh ingredients. Yeah, have you tried? Some experienced pizza makers? Have you tried pizza? Are you sure you've tried pizza? Because you've not had pizza if you haven't had an amazing flatbread with caramelized onions and wild mushrooms and
Okay.
just a tiny little shaving of truffles. Yeah, I'm just saying, you know, we're really not in competition.
Right.
I had a lovely Asian foot massage just the other day. And they are 7 same moves over and 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 over again for 30 minutes. And I'm sitting there like, I just really wish I could teach you how to work the toes. If you have not had an Asian foot massage, I highly recommend go get a session. It'll alleviate some of your frustrations around that. You're like, oh, okay, yeah, the baby oil or Vaseline up to the kneecap. That's good. I'm secure in my work. But I don't mind getting a foot rub. It's totally fine. I'm like, okay, foot massage. Sign me up. But not when I want reflexology. Anybody else been to an Asian foot massage place?
No.
Oh my goodness. Okay,
Yeah.
who needs the buddy system? Who wants to go? I'll go with you.
Listen, my feet, Amy, you know, my feet are so sensitive. I don't even get pedicures because they hurt me. Like I'm always like, I don't want to go there. They're just gonna hurt me.
Oh, I'll take you to my place. They've got a really nice woman who's very light.
All right, it's a date.
We'll go together.
What is the place called?
It's called Joy Reflexology. It's one of like 5 or 6 places I've visited in my immediate vicinity.
Oh, okay.
But like
Do
the
they
big
know
one,
that you- do
they've
they
got
know
like a
that-
neon foot sign in the window or something. Yeah.
do they know that you're a true reflexologist?
No,
Oh, yeah.
no sense in stressing them out.
She comes in wearing her special name badge.
Yeah.
President of the Texas Reflexology.
That's
No,
funny.
that would just be a little bit rude.
We can't have, or we're not supposed to in Connecticut, have, do reflexology without a license. It
Oh yeah,
falls
no,
under the
same.
massage,
So
massage.
yeah, what they're doing is massage, and so they need to be licensed as massage therapists.
But I had gone to Newport, Rhode Island one time, and my husband and I both got a reflexology session. And it was interesting. The lady that worked on him, I kept looking, we're both laying on these tables that weren't too far off the floor. They were kind of low. And so I was watching what she was doing. And then I had a younger therapist working on me, or a younger person working on me. And I think she had 3 moves, not the 7 you're talking about. For the whole, we had done an hour. And my husband loved his because she was experienced, and we were side by side, but I kept looking to see what she was doing. No intake at all. It was just,
no.
yep, just, come on in and lay down. And so it was interesting. I didn't tell him I was a reflexologist or a massage therapist. I just went in, and it was interesting. It was very interesting to experience it.
No, I've had Asian foot massage in every country I've traveled to. Every big city I've been to. I always go to Chinatown. I've had, yeah. I enjoy having my feet worked on, especially if I'm traveling.
Yeah.
But it's a hit or miss.
With Western styled reflexologists, and had reflexology, Western reflexology in a number of countries as well, which is great.
Yeah.
So yeah, there's space for both.
Yeah.
I'm not
I
in
think
competition.
I think they do like on the job training. Like the girl that was working on me was trying to follow what she was doing. That's what I noticed.
Yes.
And there's not a lot of education behind it, like we do.
Well, and it's all based on Father Joseph Euxter's moves. And he was a self-taught reflexologist, read a book on it from Hannah Marquette, and that's what we're looking at today. And he's made formal apologies for not knowing anatomy and physiology, not knowing that you just can't sit there and knuckle up and down the plantar hallucis longus all day long till the cows come home, till you send your client, your foot massage client home with tendonitis.
Yeah.
He didn't know. And so we're working with what we have. It's okay. We got what we got. I know that I've met reflexologists from Japan, Taiwan, Vietnam, Thailand, and South Korea that have all traveled to North America to study Western reflexology, the reflexology we all know, so that they could apply a more Western approach to reflexology at their practices back home, which I think is really cool, right? I've met a number of them at the Raw conferences. I'm hoping I get to see some of my friends at the Raw conference, right? That I can be like, hey, how's reflexology going in Okinawa? How's reflexology going where you're at right now? How's your practice in Seoul? Tell me, I want to hear about it. So I think that's cool. And they call it European reflexology in Asian countries when you go travel. It's, we offer the European style of reflexology, and it's not a foot rub, right? It's not just sitting here knuckle and popping the toes and then slathering some more some more Vaseline or whatever they're using. I'm like, oh my God. It looks a lot closer to the Western style that we are familiar with. So I think maybe collectively as a mindset, be like, okay, Eastern foot massage, Western reflexology.
Did they use tools, Amy, when your Asian reflexologist?
I've been to a number of places that use tools. I'm trained in Thai foot massage and I'm trained in Father Joseph's. So I use dowels in both of those techniques. Yeah. Mm-hmm. Yeah. But you do
I haven't had that work. I haven't had tools used before when I've had sessions, but so I was curious with the different.
Do I need to pack some tools in my luggage? You're going to be at the Raw conference next week, right?
I am.
So maybe I need to bring some tools. Are you ready? Are you ready? I haven't used tools on Brandy.
Oh, I don't think she's gonna like tools unless they're very light.
They do add some depth to a session. They give you some alternate ways to access some things. I'm hoping to bring them in for when I want to run a headaches workshop here and be able to do some hands-on training. You have to have the hands-on training in the tool work for your insurance to cover you for using tools in your practice, right? So I'm hoping that I'll be able to bring in some tool work and get folks be able to start working.
Is this the same migraine deal you were talking about before, or is this a different? Was it okay?
Yeah, I want to do a webinar for those that aren't local, and that won't include any tools because I can't teach you tools over the internet, right? Very much about touch, posture, the way you're using, anyway. So I want to do a workshop here in the studio, and
I'd like to be able to make that. I'll have to.
yeah, I'm rolling some dates around. I think May, potentially June. We'll see.
I think I could make that happen.
Cool. They're not necessary. You don't have to use tools to be an effective reflexologist.
Oh, no.
But there are times that tools can heighten your work, but not necessarily it doesn't, I'm not in the no pain, no gain camp, right? I'm not, I'm not over here like, we're going to use tools so it hurts more.
Yeah.
No, we're going to use tools so that we can get at a reflex area in a different way, send a different kind of signal, right? The varying pressure technique that we're using hits on different sensors in the pressure sensors in the feet, right? Our mechanoreceptors. But different mechanoreceptors have different jobs, and we don't hit on all of them. We don't light all of them up when we're doing our thumb walking, when we're doing our finger walking, when we're doing our hook and back up, right? The knuckle work. We don't light all of those mechanoreceptors up. So adding tools from different perspectives can light up some more of those mechanoreceptors than just finger and thumb pressure techniques, right? So
Do you
particularly
work with
helpful with like
tools
really
like this?
different, like really stubborn, deep-seated, people that have had migraines for a long time, people that have had headaches for a long time, right? Things that are really, really, really stuck. That's when I tend to bring tool work in. I
Do you
don't
use this?
No, I don't use an AccuFinder tool.
No. I use this to point to things when I'm teaching.
Me too.
Oh, you got one too? Yours
Yeah.
is silver? I have a
Yeah.
silver one somewhere, but yeah. Yeah.
I mostly use it when I'm teaching ear.
Yeah.
Those
Yeah.
tools are great for the choreo hand therapy, the KHT. They're wonderful. So when you want to get into that other hand map and really get into somebody's lumbar spine from their whiplash that they have or something like, yeah, I mean, that thing blasts the pain away like that. I mean, it works fast, which is wild. So I love those tools for hand, but I don't use them on the feet. They're too small.
Excellent.
But yeah.
Mine has 2 ends. Does have a little bit bigger.
Oh, yeah.
Yeah, that one we use the rigidity, the long, yep, the mid piece.
Yeah.
And just roll it down the spine on the hands. Y'all know about the Korean hand therapy, the KHT choreo hand therapy. So in that one, the arm, leg, spine. So this would be the tailbone, the coccyx. This would be the back of the head. And so you work that all the way down with that tool. Slow and easy. And if that feels nice and you enjoy it, go take the class.
What is that called again, Amy? What kind of hand therapy?
Choreo, Koryo, choreo hand therapy, KHT. It's sometimes called Korean hand therapy.
That sounds interesting.
It is an interesting modality. And a very different map if you're used to like, this is the spine.
Right.
You're like, wait, the spine is, hold on. I gotta think about this.
Yeah.
Yep. Different. Cool. Effective. I use it on all my clients that were trying to do some weekend warrior stuff and fell off of a ladder painting or, cleaning gutters or whatever. It's magic for acute back pain.
Oh,
And of course, like, they've already been to urgent care. I'm not replacing
right.
urgent care medicine. Let's make sure that that spine has not been broken before you get in a chair. Yes, thank you. Disclosure, disclaimer for those watching the recording. Right? What else are we covering? Neuropathy. Anybody got a stubborn case you want to ask for help, thoughts, feedback?
How soon do you start working with somebody after a surgery if they have neuropathy?
I mean,
generally. I know it's different
I've been in the ICU working immediately post-op for a number of
Okay.
clients over the years. I'm probably in the ICU or med surge maybe every couple of months or so,
Okay.
as long as they're not contraindicated, right? As long as they don't have they're not presenting with a blood clot. I'm happy to work on them as early as we can get to them. You know,
Good.
help speed up the healing process. I just had one of my prenatal clients yesterday. Baby's not turning. Baby, he being stubborn. He don't want to turn. And I was like, okay, well, if you end up getting scheduled for a C-section, let me know. I will come give you a session so you can have your first poop in the hospital with assistance before you get discharged. Because I tell you what, that first post-op bowel movement is spicy. Because how do you use your core when
Wow.
you've had an incision all through all of the layers? Woo! Yeah. Yeah, don't go home alone without that first one. Yeah. Scary. Those that know. But yeah, I will work as soon as it's, medically relevant. And if they want me to work on them while they're still in recovery, right? So my clients that have had brain surgery will give their loved one a power of attorney to notify me that they are ready for, and so I'll come in and they'll still be in a medically induced coma and I'll work on them. Make sure your liability insurance is good. And as far as the hospital's concerned, I'm a good family friend who works on feet.
Yeah.
All right. And I can do that here in Texas because we don't have a license for reflexology. So I don't have to be licensed by the hospital, I don't have to have hospital privileges. So I can go to the hospital and work on clients. My acupuncture colleagues cannot. Massage colleagues cannot. If you don't have hospital visiting privileges and you are a licensed practitioner, you can't be in that building doing your work.
That's
you could lose your
crazy.
license.
Yeah.
Right? Meanwhile, in the UK, they employ reflexologists to offer pain management and support with the nausea while you're getting your chemo infusion. And, would you like reflexology over here in labor and delivery? Ease some of that. Help labor progress a little bit better. Would you like reflexology after your knee surgery, Mrs. Smith? We can bring the reflexologist to the floor. Right? So that would be cool if we got there. That'd be really cool. But I think that's a ways away.
My middle sister is having her first baby in May, and she's asked me to be with her, be in the room.
Awesome.
I'm just the sister, right? I'm just the sister,
absolutely.
But her, so
be her reflexology doula.
Yep, that's
works
I'll
the
be there.
treat. Tell you what, I've attended over 100 births, man. Reflexology is where it's at. Woo.
You're not just the sister, Brandy. You're the awesome sister. They can go in there and do that.
Yeah.
That's exciting. And if you like it, market it. We need more reflexology doulas in the world. We don't have any reflexology doulas in Texas because I retired the doula side of my practice. We could use it. I keep talking it up. I'm sure someday we're gonna get somebody who's gonna be like, I'm on it, Amy. I'm ready.
I think I'm more of the death doula than the birth doula.
Yes.
So
Yep.
I'm all about that. So
Yep. I hear you.
Hmm.
Y'all, I've drank so much coffee, I'm gonna go use the toilet. Feel free to chat while I saw my gun.
Hey, Ray.
Hello.
Hello. What, was that a heat pack or a cold pack you had on your shoulder?
Oh, I have been with that thing for 4 years. It has glass beads in it. So my normal morning routine is I throw it in the microwave for 2 minutes and then I lay back and meditate, and that's like my get myself together for the day. Um, before I got into healing work, I was an unloader in like back rooms and retail. So like my shoulders and neck have always had problems, and like that heat therapy first thing in the morning like just really helps me have more mobility in my back.
Mhm. Yeah, because my husband needs something like that, and we're kind of looking. Can you still get one since it's that old?
Yeah, well, let me see. I don't know if I go try to find the link on Amazon if I'm going to be disconnected, but I'll try to go find it. But what I also like about it is that it doesn't have a smell. Some of the rice ones have like a odor.
Oh, yeah.
But yeah, I'm sure.
I
And it also can be put in the freezer to do both cold and hot therapies.
Oh, that's
I
an
just,
option. It's an option.
So, Brenda, I don't know if you're just looking for shoulders, but I have this rice sock that I made years ago. It's literally, we just bought big men's sock. I put rice in it, the same thing, and it
Yeah.
goes perfect. I actually had it made after a surgery, and the doctor said, because it was a laparoscopic, and the air gets trapped in your shoulder. So she recommended this. So I love this. But I also have, if you're looking for, I don't know if you're into like heating pads, but I have a heating pad that at the top is shaped the same way Ray's was, where it specifically comes up the neck and around the shoulders, but then it also goes down to the back as well. And I just
Oh.
got that on, and it's wonderful.
Oh, sweet. Let's see. Here it is. Care healing pad. Thank you, Ray.
you're welcome.
And thank you for the sock tip.
Mother Earth is a company, I think they're out of Utah or Arizona, and they do flaxseed. And the lady was a nurse and a massage therapist that developed the company. And she used flaxseed because it slides on itself really well. And there's no pokey ends to it like rice or beans or whatever, corn, whatever people can use as well too. And she makes all different types, for the C-shaped one, she makes a flat one. They're a little bit more expensive, but they have the heft to it. Like Brandy was saying, the heft of the rice is good for people sometimes. What I like about the microwave ones is you microwave them and you put it on when when you first use it, and then it gets cooler and cooler. So if you fall asleep with it, you don't have to worry about it burning you if you're leave it on too long. So, and Grandpa's Garden is a place out of Maine. I order those from as well too for the
Love Grandpa's
microwave.
Garden.
Yeah.
I have one of the ones from Grandpa's Garden, and I've had it for 19 years, a little over 19 years, still trucking.
Yeah. So they're now making ones for your wrist. for both
Oh, I
hands.
saw that. Yeah.
Yeah, I'm gonna bring them to the, I'm gonna have a vendor table at the conference. So I'm gonna bring those with me.
Okay.
So people can see them. But I have a pair that I use once in a while when my wrists are a little achy.
Yes.
Yeah, I'm
Need
looking
some
for that
a
one.
whole, just like a bodysuit, right? Just a cocoon.
Oh, hang on a second. Ray, this one says natural. It says Mike. I guess I didn't get on the right one. Hang on. Because it says rice. That's not it. Hang on. Sorry. I know I got off on a rabbit hole. I think I might have found it.
Grandpa's
you-
Garden has one called the Shawl. It's huge. It barely fits in the microwave. And but it will like cover the entire back. It's huge.
This is the one that I've had for almost 2 decades. I just put in the chat from Grandpa's Garden. See if I can grab it.
Yeah, that's the big, yeah, I think that's the shawl.
That's the
one.
spa one. The
Oh, it's
spa
a
body
spa
shawl,
one.
which is bigger than their other just standard shawl.
Yeah.
And it's got smaller pockets for the stuff so it's more evenly distributed. Tell you what client comes in with a tummy ache or menstrual cramps or back pain. You throw this sucker in the microwave for a few minutes, turn it around, stick it in for another minute, pull that out, lay it right on there, just like, oh, so good. Yep.
They also have pillows for weighted pillows too for people with autism or that need like fidgety kind of things
Oh, us
as well too.
neurodivergents, we love a good weighted. Mhm,
Yeah, so that's nice.
mhm. Yeah, this sucker is heavy. I don't know how many pounds it is.
And what's in yours, Amy?
Flax seeds, and it still smells like the herbs that they put in there.
Yeah.
It's got to be about the same weight as a jug of milk.
Yeah.
Right.
I think they have little round things in them too. I don't know if it's all flaxseed for the Grandpa's Garden. I know Mother Earth is all flaxseed and herbs. I can't remember on the other one though.
Let's see.
The thicker the pad, like the Mother Earth ones, the thicker they are, the longer they retain the heat. The thinner they are, the less time they hold the heat, I found too.
Mother Earth has a 15% sale right now on also migraine and
Yep. The migraine pillows are really nice on Mother Earth. They're skinny, and they're not as skinny and long, so they cover the entire face, where the sinus one covers the eyes and the sinuses. But the migraine one, it's not as heavy because sometimes the heft on your face when you have a migraine is too much, but it blocks the light really well. And you can get them in unscented and scented. If you get the migraine one, though, I usually recommend no scent because
Yeah.
sometimes scent is too much when you're having a migraine.
Oh yeah.
The biggest drawback to the pillows when you order them is the shipping charges from those companies, because like Amy said, that they weigh a lot, and so that can add up the shipping when you make an order, a bigger order.
My favorite mask for migraines is Bucky's 40 sleeps or 40 blinks. And they are very affordable. Let's see if I can grab their link here. Here, I'll just share the screen real quick.
This guy for my migraines, my rice sock.
Yeah, that's nice too, because
Because
it conforms.
These
Yeah.
look a lot like a bra, if you will, right? They've got cups that fit right over the eyes, so it doesn't lay on your eyelids, which is great, especially for folks with like trigeminal neuralgia triggered migraines. I love this eye mask. It's so great. And they're inexpensive, 15 bucks. I tell my migraine clients about these all the time.
They come in scents too,
Nope.
and nope, just plain. Unscented.
It's just an eye pillow that has a cup that sits right over the eyes, blocks out all the light. It's got a little head strap with Velcro adjusting elastic on it, right? So you can have it on as tight as you want or as light as you want. They're super, super lightweight. They're great for travel. Oh man, this on a plane, you are gone. No sense, nothing added to them. Just I'll stick it in the chat.
And Mother Earth also has buckwheat hull pillows, which are great. They're hulls, and you can use the bigger one as a bolster under the knees too, or you can sleep with them too. But you have to get used to that noise. There's a kind of a crunchy noise to it with the hulls, but once you get used to it, it's fine. It takes a little bit though. I use the real small pillows as a massage therapist under the shoulders for women who have had mastectomies.
Yep.
Because
Yep.
it raises up their shoulders just enough when they lay on their stomach. So it's more comfortable. But the buckwheat hull products are good from Mother Earth too.
Nice. Yeah, and for those who are savvy sewists, stupid easy to make.
Mhm.
Buckwheat is super cheap.
Yeah. With all that said too, there is even, I think, Brandy, have you ever over microwaved your rice pillow? Yeah. You will get a wonky smell if you overheat it. Flaxseed, rice, any of that. So just be careful. Kind of just play it by ear with that. It's better to do it less than to do too much.
Yep.
Because once that smells in there, you can't get it out. You have to make a new one.
But sweet Josh, he'll go heat it up for me, and he comes back and he's like, "Here you go," and I can smell it coming, and I'm like, "Oh no!" And then it's like so hot, I can't even like touch it. I'm like, I can't put this on my face or my back.
Mm-hmm.
Counts. Anyway, all right, I'm gonna have to hop off soon. I think we're about 9:30. So
Yep. We're right about ready to wrap up. Anybody got anything else? Any burning comments, questions, ideas before we?
Is everybody going to the RAA conference?
I don't think so. I think it's just Brandy and I are the ones from Texas going. And
Okay.
I got my arm twisted to go and do the pilot exam with ARCB so we can get testing going this fall.
I think I might do it too. I got to figure out if I want to do it Wednesday or if I want or Thursday morning or Sunday. I have to figure that out.
Do it. They need the numbers. If we don't get the
Yeah.
numbers, if they don't get enough testers for it, they're not going to be able to roll out this fall because it's not going to get psychometrically evaluated by the psychiatrist.
Ah, okay.
So
Amy,
definitely.
I had a question about the event that you're hosting Friday morning.
Oh yeah, we had scheduled it, but I didn't get any signups.
Oh, okay.
Sorry. We'll
What if I'm
reschedule.
on sign up?
Yeah, sign up for things as soon as they see them. Otherwise, if there's not
Okay.
enough people, I don't run it.
I don't don't understand the whole, like, exactly how the algorithms work on Facebook, but I feel like it hides your groups because I follow multiple of them. They never come up in my feed. But
Yeah.
then when I go onto them, I find all these posts and it's like,
Yes.
shoot, I wish I had known.
I know sometimes it's like 6 people saw this. I'm like, oh, okay, that's nice.
You know, I just saw it, but like this week. And I was like, "Ooh, can I?" And I was like, "Nope, I got a client."
It's all good. It happened. Yeah, I'll send out an email for the next one.
I don't even think I saw anything about that, but I'm here. But I didn't see it.
Yeah, we'll do the headache one. We'll get the headache one on the books.
Amy,
Yeah.
can I get a recording of these Zoom meetings? Because I have never gotten one for any of them.
Oh.
And I would like to get so I can go back and listen and watch it again.
Yeah, absolutely. Send me an email. It takes a little while to process and then upload, but send me an email and I will I'll send you the link and I can send you the playlist for all of them.
Which email address to send?
Let's see, it's what is it? hold on, TRA Education Chair. Yep, TRA Education Chair at gmail.com. I'll put that in the chat real quick. TRA Education Chair at gmail.com.
Okay, thank
How
you.
many are there?
Good question. I'd have to go back and count. I think, what do we have? 5 or 6 or something, maybe? Do we have that many? We've only got the one subscriber over here on YouTube. Coffee chats. Doo. Trying to get it to pull up my videos here. We've got the March one. Guess we skipped one in here somewhere. December. Oh, I think the January one was kind of light, right?
One of
One,
them, yeah, one of them, there wasn't anybody there or something.
yeah, I think so. Yeah, so just a few, I guess. And then plus today. So I think we're up to 4 recorded ones. We've had a couple more, but we didn't record them because it was, too small of a group. So. All right, y'all. It's been fun. Appreciate everybody sharing stories and input. And I love these ideas of using microwavable products. I love using them in sessions. Get yourself one that has a removable outer covering that you can wash between clients, right? Just a reminder. Or pro tip, go to Target. In the children's bedding section, look for the products that are waterproof, for nocturnal enuresis, nighttime bedwetting. Yes. Get yourself a waterproof pillowcase set. Yes. They're inexpensive. They last a long time. You can bleach the daylights out of them. I can put them on the hottest drying cycle ever. They don't melt in the dryer. They're genius. They last many, 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 many washings before they start falling apart and you have to replace them. So
Good idea.
those are great. And then you can, don't microwave them because they got a zipper in it, right? Don't catch your microwave on fire. So microwave the thing and then stick it in the pillowcase after.
One last thing about Mother Earth, they actually have mitts that you can put your hands into, and they have booties.
Oh,
as
yummy. I love a good
for the
booty.
microwave. But they're pricey because there's a lot of flaxseed in them.
Yeah.
And they have them in small and large, or you can buy them. Used to be able to buy them singularly too, but I don't know if they changed that, because the originator from Mother Earth actually sold the company to somebody else, and they made some changes, and I can't remember if that was one of the changes. If you're so inclined to look for something like that.
All right.
That's cool. That sounds nice. Cozy. Don't need it for most of Texas season, but in the winter. that would
Yeah.
actually-
And they say put like a plastic baggie over the foot first,
Oh,
then
yeah.
put the the boot on. That way you don't have to wash the boot with every client, because it's covered. It's not touching the skin.
I mean, you still need to wash the boot, but it gets it less dirty.
Right, right. And I
Yep.
think it has a cover on it too, where you can undo the cover,
Oh, nice.
the pillowcase of it and
Yeah,
wash it.
nice, nice.
Yeah.
Yeah. That's cool. Yeah, I use the those compost bags that they have, those little cute green ones, right? Because otherwise we're just gonna drown ourselves in plastic waste in
Yeah.
our reflexology practice. That thing works great, and then you compost it.
As long as it's heat, as long as it won't melt. You'd have to probably check that too, because of the
Mine
heat.
don't melt. They're
Oh,
really
that's good.
resilient. Yeah,
Oh, that's good.
yeah. Feel free to reach out if y'all need any links or names or anything. I'll hook you up.
Well, I got to scoot too, so enjoyed
Yep.
it. What's
I'll have
next? Quick question, what's the topic?
So our next meeting, so this is the second Tuesday. It will be May, I think. You know what? I have a conflict on May 8th, y'all. I'm not going to be able to run it. We might have to pick another day that week.
I got to scoot.
Hmm. Well, I'll send out an email. I think unless Brandy wants to run it solo.
Yeah, I don't mind.
VP.
But we're going to talk about Raw, like some of the stuff we experienced at Raw. So we'd love to have you there.
Yeah.
So maybe the
Maybe.
15th.
Yeah. That's a good
And I-
idea. Yeah, let's just move it to the 15th. This one time.
So is it usually the second Tuesday or Wednesday?
Second Wednesday. Sorry,
Second
did I
Wednesday.
say Tuesday earlier? Sorry.
You did, yeah.
Pardon.
The-
Yeah, it's usually the second Tuesday, but we're gonna do the
Okay.
second Wednesday. I did it again. It's usually on a Wednesday morning, the second one of the month.
You got it.
We're gonna do the third one in May because of the conflict, and we're gonna talk about the Raw conference and share some of the cool things we hear from different speakers, right? Because I'm imagining we'll all be in different classes and whatnot. What days are y'all getting into? Brandy, Sue, what days are y'all getting into town?
Thursday.
Thursday.
Okay.
Yeah.
Yeah.
I leave Boston early, but I don't get in until late. So it'll be an all travel on Thursday for me.
Oof. I'm coming in on Wednesday and then I'm leaving early Sunday morning.
Yeah, I'm staying till Monday because I'm testing. So
Yes.
Woohoo!
That's exciting. I'm so excited for you.
I'm excited too. I'm just ready to get it done.
Yes. Yes. I feel you.
You'll have more info when you come back from the conference about future testing. Amy?
I'm hoping so. And I'm
Yeah.
hoping that we'll have got the numbers,
Hmm.
I really, really hope so. And I wish they would
I
have
want-
added more proctors, but I know that they're kind of stretched thin right now with proctors. So
I want to test, so,
yes, exactly. I'm like, we got to get this done.
yes.
We will. We will.
And I hate, the reason I've kind of held up on signing up to test is because you only have that year window to do it.
I
I
know.
What if I do it and then it's like, oh, we aren't at anywhere close to you or, whatever.
Right?
And then
Right?
That's the only reason I haven't gone ahead and signed up, but I'm definitely a go on wanting to test.
Yeah. Yeah, it's the way of the future. It's
Yeah.
just,
Yeah.
yep.
And you can send your documentations in early. You don't have to send those after your test. You can send it before as well too.
Mm-hmm.
So if you wanted to get those done prior, you can do that.
Oh,
It still has to be within the window of sign up.
Yeah, like, yeah.
Right
if you
now, it has
sign
to
up.
be. When
Yeah.
they change to when they switch over to the new format, it will be required when you put your application in. You'll submit your case studies at the same time that you apply. And so they'll review your case studies, and those will count towards whether you'll be accepted, or whether they send those back and go, you are not ready to take this test.
It's still 30, right?
Mhm.
Down from 90 when I took it.
Yeah. I know. Whoa, that was a lot.
And I said 50 and I only needed 30 because it
It's
was
30.
50 at one point too.
Yeah, they dropped down. Yep. At first I was like, wait, I was jilted. I had to do 90. And then I'm like,
Yes.
no, I know where I am. 90 was it. I'm not complaining.
Yeah, once you get going on them, it's easy, once you get in the swing of things.
Yep. All right, y'all. Have a wonderful rest of your day.
Did y'all just pick it? Did y'all pick a day while I stepped away real quick?
Oh,
for the
I'm
next-
sorry. Yeah, we're gonna do the 15th of May because I have a conflict for the second Wednesday of the month. So we're gonna move down to the third Wednesday of the month for May.
Okay, and so then the third Tuesday will be board meeting.
Yeah,
Should be back to back. Yeah,
We'll be
okay,
back.
that's fine.
that's okay.
That's fine. Yeah, perfect. I'm just making sure. Okay,
We'll get a lot of time together in May.
there you go. Sounds good. Okay, then.
All right.
You guys have a good week.
Nice to see
Thank
you,
you.
Lori.
Nice to
Nice
see
to see
everybody.
you too. Take care, everybody. Have a
Yeah.
nice
Lori.
day.
Okay,
Bye-bye.
bye-bye.
Bye.
Bye.